We have known for a long time that miscarriage is very common. Unfortunately, it's something that people don't talk about, and people aren't aware how common it is. And also, there's a bit of shame and stigma attached to miscarriage or losing a baby. So our big message is miscarriages is something you can do about it, is something that requires care, and it is something that we can help people with in the future.
What are the health risks associated with miscarriage, both physical and psychological?
So, first of all, there are risk factors for miscarriage. So, things like being obese, smoking, having uncontrolled heart disease or diabetes all put you at risk of miscarriage. And those things are things that you can do things about. If you do have repeated miscarriages, you are also increased risk of having problems later in pregnancy. So, it is something that you talk about, tell doctors, because it means that they should give you more care in future pregnancy. Also, having recurrent miscarriage puts you at increased risk of long-term heart disease and and vascular disease and thrombosis. So it is a warning for you to do something about your general health.
And the psychological risks as well, people's mental health?
Yes, and the major effect of miscarriage is on their mental health. So actually, even after one miscarriage, 20% of women actually suffer post-traumatic stress disorder. So it is a significant effect on their mental health, and it isn't something that should be ignored. It is something that people should talk about and receive help for.
Your study also mentions ethnicity, black women more likely than white women to have miscarriages, also pollution and working patterns such as night shifts.
That's right. We were actually quite shocked to find that, in fact, black women were at higher risk of miscarriage than white women, and we don't have an explanation for that. It's something we need more research on. We also found that women working very long hours, or particularly night shifts, was associated with miscarriage, and that's quite something challenging to do. And the other thing which we thought was very important was this pollution issue. A lot of European countries don't record their miscarriage rates, and it is actually important for all sorts of health reasons, as well as being affected by the pollution in, for example, industrial cities.
Now, you say there is lots of misconceptions, including amongst professionals. How should the treatment for women who experience miscarriages be improved?
So it's really to say miscarriage does matter. It is something that you should discuss with your doctor, and doctors should take notice of. They should account for that if people are suffering mental health disorders, and each miscarriage should be considered as a time to help people with their general health, to help with people get more healthy, to prepare for other pregnancy and for the rest of their life. People only referred people to doctors if they'd had lots of miscarriages, and our big message is do something about each miscarriage.